Is hair loss always genetic? Then why do some people with no family history still lose their hairs? Or why some people with strong family history still have good hairs at the age of 40 or more? Many people think that the hair loss is always genetic, but this is only partially true. Hi, I am Dr. Samiksha Tyagi, plastic and hair transplant surgeon. In my clinic, many times I hear from people that my hair loss is genetic and nothing can be done about this. But this is only partially true, and not understanding this may cause you more harm sometimes. Why many people blame their hair loss to genetics? Because it is a very easy thing, and when we consider that something is genetic, we stop taking any efforts for correction of that thing. When we blame something as a genetic, we do not take any measures and we cannot cure this problem as well. But medically, this is not true. Hair loss is not all black and white. Genetics is a part of it. Actually, hair loss is a multifactorial thing. Now let's understand this in detail. When we say someone is having genetic hair loss, what that means? It means the hairs are very much sensitive to the hormonal influence, which is DHT. And because of this hormonal influence, the hormone sensitive hair will gradually miniaturize, shorten, stop growing. This process is called as miniaturization, and this process is also happens in a patterned way. That means usually a person starts having hair loss or hair thinning over the frontal and temporal area, then over the crown area, and then there is a progressive baldness. This condition is equally seen in females as well, where they usually see thinning over the vertex or the crown area, but they have usually preserved hairlines. Here is the most important thing you need to understand. Genetics loads the gun, but lifestyle pulls the trigger. Having genetic factor does not mean that you will have early onset of hair loss, severe progression, and complete baldness. Your hair loss pattern depends on other factors too, and that is why it is important to understand what are the other factors apart from genetic that are important in your hair loss pattern or your hair loss journey. Many people lose their hairs due to the factors which are not actually related to genetics. Like if somebody is having hair loss due to sudden stress, illness, surgery, or any major emotional problem, a condition called as telogen effluvium, it is a completely curable condition. That person may or may not have genetic association as well. Similarly, if somebody is having hormonal problem like PCOS or the menopausal or post-pregnancy hair loss, all these conditions are completely treatable and curable. Many a times, nutritional deficiencies like multivitamin deficiency or protein deficiency can lead to hair loss. So it is important to understand that your hair loss pattern is not only genetic but can be combination of non-genetic factors as well. And if you are able to control your non-genetic factor, treat them timely, then definitely you can have better control over your hair loss problem, even though there is underlying genetic issues. I will give you a simple example. Many a times you must have seen that one sibling is having baldness, but the other sibling does not have, even though they share the same parents. This happens because apart from genetic tendency, there are other lifestyle and environmental factors that affect your hair loss. So, to summarize, hair loss is not always genetic. If you have a strong family history, then you should start prevention treatment at early age. If you do not have strong family history and still if you are having severe hair loss, then you should get it treated timely. Never self-label your hair loss as genetic and stop your chances of having a good hair regrowth again after the treatment. Hair loss is not always genetic, and there are so many things that can be done or treated so that you can have good hair regrowth even after the genetic problem. So if you want more such scientific information related to your hairs, do subscribe to our channel. Thank you.